Welcome to Perspectives on the Pandemic. I'm Alan Dow, a physician at VCU Health, here with my mentor and friend, Dick Wenzel, who's been a world expert on infectious disease and epidemiology. Welcome, Dick.
Thank you. Glad to be back with you, Alan.
Good to talk with you again. So I think one of the things that's been really big in news over the past week since we last talked is this idea of reopening America and how that happens and what it takes. So I wonder if you could just sort of tick off some of the things that you think about as factors we need to consider as we think about reopening America.
Absolutely. So first, maybe just to frame the question, where we are today and where we're really trying to get to. Where we are today, we actually know something. We know, both internationally and nationally, that social distancing works. Those countries that got early, China, South Korea, Singapore, did much better with their rigorous program than those that delayed it, including our own country, Italy, and Spain. And even within the United States, the states that got out early, Washington State, California, are now flattening the curve with a lower slope than those that were delayed, like Louisiana and New York. So we know social distancing works. To look at the far bookend, just to know where we're really heading, if we can, once we have a vaccine that will actually be efficacious or highly efficacious, then we'll be rid of this thing because we'll have enough people immunized eventually to have so-called herd immunity. In other words, the community immunity high. That's probably a year, maybe even a little longer away. So now we're talking about what happens in the meantime. So if you said, where might we start? One of the thoughts that I've had is start with retail stores. And actually, I think that would be fairly safe. And I'm talking about department stores, small stores that sell music or bookstores or jewelry or leather goods. I think we could probably even open up those as early as May or June. However, the caveat is we still, in my view, should be cautious, wearing masks, keeping the 6 foot or more distance. So I think if we were cautious, and then if we had good testing, which is one of the problems, we started opening up all the tests to look for who's ill and not, and even who's got antibody, the 2 different tests, who's immune, who's ill and maybe silently ill, the asymptomatic ones. We can then see this as an experiment. If we did that in May or June and we waited another month and we saw, wow, no surprises, no spikes, then we'd say, well, let's continue with that and we'll think about something else, for example. But I think we could start that fairly early on.
Okay, yeah, so I've heard sort of this social distancing, mask, hand washing, testing, thinking about vaccines. Are there any other sort of considerations that we have to have as we think about opening up the social distancing a little bit more to have these kinds of activities happen where we start to interact a little bit more closely?
No, I think a lot of this will be driven by what's happening in your community, your county, your state. And if, for example, you had good counting and you know the maximum incubation period is 14 days, if you were really careful and cautious, wanted to roll whatever you want to do slowly, carefully, you'd say, let's wait for 2 maximum incubation periods, 28 days. And again, if we opened up, let's say the schools or something, you'd say, wow, no transmissions or almost none in my region, and I could trust the data. 2 maximum incubations. This is successful. Maybe we can begin to open things up even more. Now, let me give you an example. It's possible that we could think about opening up schools in September, but it doesn't have to be, open the switch, everybody comes back to school. We could introduce a hybrid, which is to say maybe the kids would go to school 2 days a week, homeschool 3. We do well for 14 or 28 days in our region and no or very few transmissions. We could even increase the day at school, 1 day at a time. So that after that period, we'd say, okay, 3 days of school where they're present there, and then 2 days at home where they're homeschooling. Go to another 28 days, fine, 4 days, and so forth after 5. And if we're careful, we don't see any spike, we say, wow, this was a very successful experiment. It may succeed in some areas and fail in others. We'd have to know what's different about the schools that did well? Again, counting is important. So I'll constantly say we're way behind in testing, both for the infection and for the antibody to know who's immune.
Okay, so it sounds like the key is really how we ease up social distancing based on being able to test and know what's really going on and make sure we're not going to overwhelm our hospital capacity. Does the development of medications matter, or is it really the vaccines going to be the thing that helps us get to the end of this?
Well, the vaccine is the ultimate goal, but in the meantime, if we learn, for example, in the fall that we have a drug that works fairly well, we could use it not only for therapy, but see if there are experiments out there that say, look, for our high-risk people, while we're going through this 1-year transition period, if they could take that safely for some period of time, and then we avoid our most vulnerable people getting ill, that's a big piece of the plan, I think, early on, or at least in the first 6 months of our year-long journey, or maybe a little longer.
Okay, so why don't we maybe grade these sort of where we are right now. Today is April 16th, and I think it's helpful to put a timestamp on it, and then we can kind of see where we're going as we progress towards your idea of maybe opening stores in May, thinking about some opening of schools and things like that in the fall, and sort of see where our grades are if we're getting to the progress we need to meet those benchmarks. So, Dick, if we think about social distancing, masks, hand washing, how would you grade us overall as a society in terms of how well we've done with that over the past couple weeks?
Yeah, I think we get an A minus at least, because we know it works. We know more people are isolating themselves socially. We see people wearing masks much more frequently on the street, but there's still people out there celebrating in groups and not really adhering to social distancing. They'll slow us up. They'll also be the unfortunate victims. And whether it's just denial or hubris or arrogance, I don't know. But those are real issues that we have to grapple with, I think, along the way. But I'd say overall, as a country, we're really doing better. And it's showing in the flattening of the curves, A minus.
Okay, yeah. So it sounds like most of us get A's, and then we got a couple of people that are dragging us down with the long tail of
Yeah,
D's.
yeah.
Yeah. And what about testing? So you said we need a lot more testing and be a lot lot wider spread. So today, where do you think we are with testing? What letter grade would you give us?
Yeah, I'd say we're not doing very well, and we're barely getting by and almost flunking, but I'd give us a C minus. This can improve quickly if we get industry behind us and the government behind us and the supply lines in check. But right now we're a C minus.
Okay, yeah, and I think we probably started at a D minus probably, so a
Yeah,
little
we've
improvement.
improved a little bit. Yeah.
Okay, okay. How about hospital capacity or system capacity? Where do you feel like we are at this point?
Well, we're probably maybe at a C plus. We're just turning the corner where many hospitals, I've talked to friends in New York City where they've just been overwhelmed. And now they're beginning to see that they have the capabilities in critical care units. Still some hospitals, not enough masks, not enough protective equipment. But I think we're on the way. But I would say a C plus, we're almost at a B minus, but C plus today.
Yeah, well, it's interesting because I've seen many more efforts of, say, ventilators or healthcare personnel moving to different parts of states or around the country to try to meet the needs as the epidemic has evolved, and there doesn't seem any sort of systematic planning of that kind of thing. But do you think that's possible that we'll ever get there?
Well, we need systematic planning, and that'll be part of the after the vaccine or after COVID. We could start now. In other words, how are we going to build the next robust public health response? And there's an enormous number of lessons. You and I could talk for a long time about that. The problems that we are faced with now because we weren't ready, whether it was the testing, the early use of social distancing, the coordination, and getting ready with, let's say, more elegant, more eloquent platforms for vaccine development and drug development. We're very slow. We need an awful lot of change because the next one could be even worse than this one. And that's how I would look at risk management. Not just look at the worst one we've had. Imagine something worse and then prepare for that.
Yeah, it's a daunting idea to think about
Yeah,
the investment we need to do that, but it's going to pay dividends. I mean, based on the cost of what's going on with the society right
absolutely,
now.
absolutely.
What about therapeutics and things that we can also use for prophylaxis for people that have been exposed? Where would you grade us right now on a scale of A to F?
Well, I would say that really are testing a large number of agents, but the experiment has just started, in the last couple of weeks. So we don't know where we're going, and it's hard. I give certainly a B for at least getting these out there. The uncertainty is what the next month or two are going to show us in terms of results. We're looking to be lucky. We're looking to have the right vaccine. There are a number of vaccines out there that are being discussed, as many as 30 vaccines. And as far as therapeutics, there are probably almost that many, with a handful that are actually in clinical trials already. Sooner we get those through, be able to answer, gee, how might this really move us more quickly to the goal?
So it sounds like you're giving us a B for the process of testing these, but sort of an incomplete grade at this point with applicability to society.
I think you'd have to say incomplete.
Okay.
We're just too early.
Yeah. Okay. And then for vaccines, I guess a similar kind of grade.
Yeah, I would. I mean, I like the entrepreneurial spirit of, let's say, private industry, government trying to get out there together. And I've heard about 30 vaccines in the pool. Most of them, may not make it to testing after they are tested in animals first and then in small numbers of people for safety. But a couple of them are going to be moving ahead, and we'll look for something maybe in 6 months to see, are they safe? And then something else maybe in a year from now that, yeah, they're not only safe, they look to be producing a lot of immune response. And we think those surrogate measures mean they're going to be protected.
Yeah, so it's interesting. You're making me think that we're really on several different timelines. There's the long-term vaccine timeline that, as you said, will be a year at least. The drug timeline, which is a little bit shorter, hopefully, but may hit roadblocks if things don't work. And then there's this timeline around the social distancing that really has to do with how long we do this based on testing and on hospital capacity to be able to care for people.
Yeah, I would agree with that, Alan. I think what we're really talking about is a number of experiments, is what I would put that in quotes, as we roll out the reduction in the social distancing, whether it's with the retail stores early, the schools, and then what follows after that.
Yeah, so just circling back to that, so you're hopeful that we might be able to see some retail come back in some form, May or June, maybe schools in some limited type of way in September, if the conditions are right. What about things like going out to restaurants? When would you see that being able to happen?
That's harder to predict now, but I think that'll be later. So if we roll out to schools, we find we're successful, we have to think creatively. How can we get our restaurants back on, on service anymore? Because everybody wants to go to a restaurant. It'll be even more compelling after all of this. But, it violates the social gathering principle. And the question is, can we, maybe with restaurateurs, come up with a creative spacing model? Maybe some screening of people. They're talking about maybe taking the temperature of people. It's very insensitive, but it'll miss maybe half the people, or perhaps a little less than half. But I think some creativity is really in order, and I would tell restaurateurs, come up with ideas, because they're testable once we have good counting, which is to say a good number of people we really can know who's infected, who's not, and who's immune. And obviously, wouldn't it be interesting if your waiter said, well, I wear a mask in delivering this, but I want you to know I'm immune. I have an antibody. Here's my card. I want to make you feel a little more comfortable. We would never have dreamed of that, a year ago, but we have to think in new ways, I think, as we try to come up with the answer to your question, which is really timely, very important for the people who work in restaurants, who own restaurants.
Yeah, I'm imagining my favorite restaurant giving me a job to give physicals to people as they come in the door, and I might do it for the right price.
Well, the other thing you could do is if we had a 5-cent test to test whether you're infected and a second one whether you're immune, and you could get those done the day before your reservation. Uh, well, that's far out, but maybe not. Somebody may come up with that.
Yeah, it's amazing to think how things might scale and change, and what the repercussions that would be sort of abroad, across everything that we think about in health these days.
It'd be a new vision of how we interact with each other.
So let me ask about then sort of the next level of things, which would probably be like concerts and sporting events with a live audience. When do you see those kinds of things being something we could access again?
Yeah, that's probably even later on after restaurants, because I think restaurateurs will be creative somewhere. The problem is, again, the social distance violation. And can you be creative about a ballpark, a concert hall, a theater, to know that if we put people every 10 seats and 10 rows, will that work? And will that be enough for the people who own those kind of establishments? I don't know what the economics are for that. I would love to try that because I believe in experiments. So if somebody comes up with the experiment, and then if we could count, let's say, I think we ought to get, by the way, a national registry as much as possible, but at least regionally said, okay, the last 1,000 people that went to our new creative way of having a theater, only 2 got infected in the following 2 weeks. Well, be phenomenal. Again, this is total different thinking than we've ever kind of come up with before, but I would like to think that we're doing an experiment and we could count and to know whether or not it's going to be successful or not. That would be very reassuring.
Yeah, well, and I forget who said it, but adversity is the mother of invention. So we'll see what
Yes.
this adversity leads to in terms of invention.
Yeah.
All right, well, good to talk to you, Dick, as always.
My pleasure, Alan. Take care. Be
All right,
safe.
take care.